Cece, and I'll be taking care of you first here in Dream City Clinic. Okay? Just keep sitting down in your medical bed. Okay. You're here for the 3-hour-long nurse exam in bed, correct? Okay. And just to double check, could I get your first and last name? And could I get the spelling of that name? Is that with an I or an E? Okay. Just keep sitting down, don't worry. Perfect. We have you all checked on in. And what we're going to be doing is asking you to sit completely still in bed while we perform the medical exams to send you off to sleep and study your health for the next 3 hours, okay? I'll just be running your preliminary health exams before we send you off to the first nurse, okay? Good. Relax in bed, please. Try not to move. And may I begin my exam? Good. I'm just going to put my hands on your forehead. Let me know if you feel that, okay? Can you feel that? Okay. Any pain when I put pressure there? Okay, just keep still. And what about on this side? Any pain? Okay. I'm just going to raise your medical bed up a little bit and put it right back down when I send you off to the first nurse, okay? So you're just going to raise slightly so I can examine you a little better. Great. And are you okay? Good. Just going to get my medical chair while you relax in bed. Now I'm just going to examine you up close, okay? We're going to be a little quiet as this is a sleep facility and it is late at night, so let me know. Can you see the light right there when the other lights are on in the room? Okay, can you see that? Okay, let me turn the lights off because it can be a little distracting. We want to send you off to the first nurse as soon as possible, okay? Can you see that light better now? Yes, you can. Good. And does that light cause any pain towards your eyes, yes or no? Okay. And can you see the light from back there? Good. And on this side, can you see that light right there? Good. Try not to lean forward. Lay back in your medical bed. Okay. And I'm going to bring the light a little closer. Can you see that there? Good. And does this light that close to your eye cause any pain or stress? Okay. And pull away. We'll have other nurses perform more detailed exams for you. So have no worries, okay? And then can you just simply follow the light for me? But try not to move your neck or your shoulder, okay? Good. Just follow the light. Great. Good. Good. Okay, you're doing well. Keep following the light. Good. All of these medical tests and various testings will just help us understand your health patterns while you get more sleepy to figure out your perfect sleep schedule, okay? Very good. I'm going to turn the lights back on now, okay? I'm going to check inside your ears, and all you have to do is let me know if you can hear it, okay? So, I'm going to go all the way over here. Can you hear this when I just examine your ear? And can you hear that? Good. On the other side, let's just examine the ear. Could you hear that? Good. Okay, I'm just gonna check just in your nose now. Just look up and breathe in and breathe out through your nose. The other side. Breathe in and breathe out through your nose. Very good. Okay. Now say ah. Ah. Great. Okay. And we're just going to get a quick little temperature reading here. Have you been feeling sick at all the past 2 weeks? I'm just going to put this on your forehead. You'll hear a little beep. Good. And once more. Okay, it got a better reading this time. Perfect. You're at 98.6 degrees Fahrenheit. Which is perfect. Once more, just say ah. You'll hear a beep. Good, and once more. Perfect reading this time. Okay. And do you have any difficulties hearing recently, or any difficulties seeing with your eyes? Like a necessity for glasses or any type of hearing apparatus? Okay. Have you been feeling frail or ill the past 2 weeks? Okay. I'm just writing your info down, okay? And how's your sleep been? Not the best. What has been the issues? Okay, maybe not sleeping fast enough or not getting over 8 hours of sleep a night. Okay, well, we're going to study what helps you sleep with medical tests to see what does it, or if we can find anything that helps you fall asleep, okay? Okay? But before I let you go, a couple more tests. Just a little bit of cranial nerve testing here. Can you feel that? Good. It's just vitals tests. Could you feel that? And what about there? Close this side. Could you feel that? And what about now? Good. Keep your both eyes closed. Could you feel that? And that. Okay, right there on the chin now. I'm just checking for reflexes with your cranial nerves. Okay. Test the shoulders. Good. Other side. Any pain? Okay. Give me your arms, please. Just relax in bed, okay? Good, and this side. And then your hands, please. And then bend the knee. Okay. Your reflexes are good. And you're ready to go along with the beginning of the 3-hour nurse exam in bed. Again, the rules are simple. Relax. If you fall asleep, that's good too. I'm just going to stick 2 stickers on your forehead right now to make sure that we can analyze when you're feeling relaxed, to analyze when you fall asleep. Let me get those. Okay, here comes the first one. Here's the second. Okay. Other professionals will add other stickers to analyze certain things, but we've got you ready. I will see you in 3 hours. Have a great rest of your evening now. Okay, goodbye now, and we're sending you on to the first person. Ciao. Relax and stay seated. Okay, and let's go. Looks like we have a patient here who needs a final exam for the full body exam after. Yes, perfect. Let's wake you are here in the clinic because we have to watch you overnight. Do you remember that? Good. Today we're going to be giving you just a basic exam. You're going to just sit in bed and relax. And I'm just going to ask you a couple of questions, especially on your health, your sleep, how you're feeling, and then general overall medical exams. Is that okay with you? A lot of people end up falling asleep during this, so don't worry. We'll just do the re-exam in the morning if that does happen. Good. I'm going to get my gloves on now, okay? And I'm going to ask you a couple of questions. How are you feeling? Just to feel a little bit of a sore throat. Yes. Are you feeling tired too? That's what I thought. So, you were under our care now for just a little bit, and then we get to let you rest for the rest of the night here too. Is that okay? Yes. And in the meantime, would you like any more pillows? Or maybe a popsicle afterwards? Okay. So, I'm going to ask you first. Just relax. I'm going to lift your bed up a little bit if that's okay with you. Okay, good. Just relax. Okay. You still get to lay in bed. I just had to lift you a little bit, okay? We're going to get some of your vitals first. I'm going to put some pressure on your lymph nodes. You tell me how that feels, okay? Good. Just a bit of pressure here, darling. Are you feeling okay? Good. And then I'm going to ask you, can you just follow my finger for me? Good. I'm just going to put my hand right in front of your ear. Just follow my finger, okay, darling? Good. Right there. Good. Right there. And then right at the center. Good. And I gotta ask you this. It might seem silly, but it's just to check how you're feeling. How many fingers am I holding up right now? Very good. 2. Good. How many fingers am I holding up now? 3. Very good. How many fingers am I holding up now? Very good. It might seem a bit silly, but we just check that, especially when you're tired and especially after a small little procedure like your tonsils, okay? Good. Now, at any moment, if you feel bad or whatever, let me know, okay? I'm gonna get your temperature now. Do you feel any type of way cold, too warm? Just let me know. I'm gonna put my hand next to your face. You're gonna hear a slight beep. Okay, perfect. I'm gonna double check and get that one more time, okay? Perfect. You're working at a perfect temperature. 98.6 degrees Fahrenheit. Very good. I'm gonna get your heart rate now. Now this is gonna be a little cold. I apologize in advance. Okay. I'll warm it up to the best of my ability. I want you just to relax and breathe in, okay? I'm gonna place it on each shoulder. Just breathe in. Good. Other side now. Very good. I'm going to place this next to your stomach now. I know you haven't eaten in a while. I'll get you some food as soon as I can afterwards. I'll make sure I can sneak a nurse in to get you maybe some soup. But we're just listening to the sounds of your stomach, okay? It might sound a little funny, but just relax. Good. So I'm going to place this right there. Good. Great. Now I'm going to listen to your lungs. Just breathe in and breathe out. I'm going to reach all the way to your back. Apologies for that. Breathe in and breathe out now, okay? Just 3 deep breaths. One more. Last breath in. Very good. You did amazing. A lot of people typically fall asleep at this point because all of the relaxing and breathing exercises happen now. Okay. I'm gonna get a little bit of your blood pressure now, okay? And especially after anesthesia and stuff, we always double check, okay? Now I'm going to ask you just to bring me one of your arms, okay? Specifically your left arm. Okay, cool. Does that feel okay? Good. And I'm going to listen while I do this. Okay. Just relax, okay? Very good. Let me write that down as the number. Very good. I'm going to remove that from your arm now. You're going to feel just a little bit of a pressure release. Feel good, right? Yeah, there you go. Let's remove that. Good. Okay. Now I am going to shine a light into your mouth, okay? Say we're going to be checking to see if everything is looking good, is healing okay. Good. I know this is uncomfortable, I apologize. Just say good. Oh, that looks perfect. Do you have any excess, any soreness? Just a little bit right now. Okay, we'll add a little bit of medicine, okay? If anything, this looks perfect back there and it looks like you're doing fabulous. Yes. Just say again, okay? And I'm looking at your teeth now too, just making sure, okay? I always triple check to make sure everything is healing well. Okay, very good. Just double checking here, okay? Let's see. Good. That looks fabulous. It looks like we have amazing recovery there. I'm going to add a little bit of medicine, okay? I'm going to ask you just to say, yes. This is to help with healing and make sure that you are dealt well with a little bit of the unnecessary pain, okay? Just say, good. you that medicine as much as we can. And I do see you're getting sleepy. We will be able to finish this in a little bit, okay? So, I'm gonna check your eyes now. I always double check and triple check everything, especially vision. Some eye drops in there afterwards, okay? Look at the light for me, okay? Good. And can you look up here for me? Good. And can you look below for me, please? And look right back at the center for me, okay? Good. I'm gonna get a little bit up close now. It might be a little bit obnoxious. I apologize, but I'm just taking a look at your eyes, okay? Can you look up here for me, please? And then can you look down here for me, please? Then look at the center right there, okay? Follow the light, okay? I'm gonna put my hand right next to your chin. Follow the light to your best of your ability. I'm checking to see if you have any problems with your eyes, okay? Good, thank you for understanding. So, just follow the light to the best of your ability, okay? You're doing great. You're doing good. You're doing good. Now, follow the light as I move the light up and as I move the light down. Good. Good. Now I'm gonna just carefully, absolutely carefully get a little closer to your eye. I want you to look right at my nose, okay? Very good. Look at my nose. Good. Perfect. I do see that your eyes are dry. I'm just looking to see if you have any. Look at my nose. I'm looking to see if you have any problems caused by the anesthesia, etc. Your eyes are looking great, by the way. Okay. Now, I'm going to ask you a couple of basic questions. They might seem really basic, but to double check your health, okay? Thank you for understanding. Okay. I have a Snellen's chart. It's like an eye exam chart next to me. I'm going to point to a letter, and what I want you to do is let me know what the letter is, okay? Good. So, I'm going to put this right in front of your face, okay? What letter is that right there? Can you read that for me? That is an F. Very good. What letter is this one that is right in front of me now next to the F? That is P. Very good. Can you give me a word that starts with the letter P? Very good. Pineapple. I like that. Now, what is the letter next to P? Very good. That is H. Good. On this list, what is the largest letter that you see? Take a look. Good. It is E. Very good. Now, I'm going to let you read a second line, okay? One line below. What letter is that I'm pointing at right there? That is O. Good. What letter is that right there? L. Can you give me a word that starts with the letter L? Very good. My favorite word is lovely. Now, what is the letter next to L? C. Good. And what is the letter next to C? That is F. Very good. Now, a quick color analysis set of questions. Do you see the two colored blocks that are on the bottom of this chart? Good. What color is this block right there? That is red. And what color is this block? That is green. Very good. again, it might seem simple, but it's just to test your eyes, your vision, etc. Okay, I'm going to cover one of your eyes now, okay? And do you see this pen on this side? What color is the pen? Good. And do you see it moving? Good. Other side. Okay. Do you see the pen moving? Good. And are you still able to see it the closer I move the pen? Good. And what color is the pen? Orange. Very good. Once more. Okay. And do you see something moving next to your eye? Good. What color is it? Very good. It's blue. Other eye. And do you see the same pen moving next to the other eye as well? Good. Very good. You do. Awesome. Okay. I always triple check your health. So, I'm going to add eye drops to your eyes now. And looks like a similar bottle, but that's because they're just clinical. This one's to add moisture to your eyes. And it's going to actually allow you to sleep easier. Yeah. So, I'm going to just carefully pull a little bit of the eye like so. Okay, then I'm going to add a couple of drops, okay? Other eye. You're doing great. Good. Good. Now I'm going to ask you to do an exercise with me. Okay. Blink. 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 Very good. Do you feel your eyes getting a little bit sleepier? Good. I can see that you are relaxing as best as you can. Once more now. Blink. 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 Very good. I'm just writing this down. Give me a couple of seconds, okay? Good. Okay. I'm gonna check the rest of your body now, okay? I'm gonna ask you, can you raise your arms for me? Good. I'm just gonna carefully feel the arms, okay? Good. Okay, other arm, please. Okay. And then can you just carefully shake my hand with this arm? Good. Shake my hand with the other arm, please. Good. Good. Now, are you able to bend the knee at all? Okay, just bend your knees, okay? Bend your knees. Good, other knee. Good. And then can you wiggle your toes? Very good. Let's just carefully make sure that you are all tucked in. Carefully making sure you're all tucked in. Okay, I'm gonna get a musculature tool. Okay. I'm gonna tap this on your collarbones, your arms, and your knees. You will react the way that you react, okay? Good. So just carefully tapping here. Good. Good. On the knee now. right at the ankle. Good. Now I'm going to apply a little bit of a soothing medicine right at the neck. And we have a atomizer here. I'm going to let that run as we apply the soothing medicine, okay? So just relax. I'm going to apply that right to the neck. Just going to carefully brush. Okay. We always apply a soothing medicine, especially after your tonsils have had any sort of anything done to them. And this has a bit of menthol, especially in the atomizer that has the menthol. And as we apply, it should soothe. I also see your eyes closing. That is 100% okay. We did check your health, and we did do the full body examination, head to toe exam as we call it here. Meaning that your health is superb and you are healing absolutely well. Again, apologies for waking you whilst you were sleeping. It is just something that we have to do to make sure you're recovering well, okay? So, we're just applying that all the way from the side of under the eyes down to the neck. Just going to carefully apply a little bit like that, okay? And just going to double check, okay, a little bit like that, so okay. 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 Okay, a little bit up close. Okay, I'm just going to carefully apply that soothing ointment, making sure you're good. Okay, just relax. Okay. Beautiful. That is everybody's favorite part. Okay. And I'm gonna check once more. Say ah. Good. Just say ah. Good. Perfect. It's exactly as it is. It's just that you're recovering perfectly well. So I'm going to drop you down again and I'll let you fall asleep. I'll dim the lights. I do have to take a couple of notes though to finish up this because you had been awoken. I'll let you sleep. But I will have to finish up my results here in the room and then I'll let you go, okay? We'll check you back in the morning to make sure how everything is feeling. Now, I'm going to lower the bed. I'm going to get you an extra pillow, an extra blankie. A lot of people end up getting a little bit cooler, a little bit more cold, especially after a little bit of anesthesia. And then we're going to give you another set of medicine in 4 hours, let you sleep, test you in the morning, more medicine, etc. Okay, good. So let me lower the bed. I'll even get you a little popsicle. And do you want some soup as well? Okay, so I will bring that in as soon as possible. I'll get another nurse to bring it in, okay? If you need me specifically, I am Nurse Cece. There is a button that is next to the side of the bed panel. Do you feel it? Yes. Hit that and that calls for me. The button below that's in the green calls for food or any type of pillow or blanket surface, okay? Good. So, I will get you an order of soup and a popsicle. Sound good? And then I'm going to just carefully turn the lights off and finish up some notes in here. Just relax, okay? Good. Thank you so much for being so patient, and we will get you that as soon as possible. Cheers. Okay. Hello there. Pleasure to meet you. I'm Nurse Cece, and I'm going to be performing a nurse exam while you're in bed. Is that correct? Great. Pleasure to meet you. Yes. Just sit back and relax in the medical bed, and I'll just perform the exams, okay? Are you okay with me being your CNA today? Okay, let me know if that changes at any point. What I'm going to be doing today is just checking you head to toe before the doctor comes on in and checks you afterwards, okay? Fabulous. So, I'm going to open up my notebook here first. And on my chart, it just says that you've been a bit under the weather, a little bit sick, and that perhaps your sleep hasn't been too good. Would you say that's correct? Okay, a couple of personal questions before we begin with the physical exam. Could I get your first name and the spelling? Okay. Do you spell that with an I, an E, or a Y? That's a beautiful name. And last name, please. Gorgeous last name. And may I get your birthday and the year? And I do have to ask this, it may be a silly question. Do you know where you are right now? Good, you're at Dream City Medical Center. Do you know what day it is, what the year is? Great, thank you. I always have to ask that before I begin. So, what we're going to do is perform a basic medical head-to-toe exam while you lay there in the medical bed. I'm going to first just clean my hands with some sanitizer, and I'll get gloves on as soon as we start touching around the face, okay? So, how are you feeling? Okay, I'm going to get just a quick vital from you first. May I get your temperature? You're just going to see a flash. Just sit still, and it's going to swipe across your forehead. 3, 2, 1. Okay, it looks like that was a bit warmer than usual. I'm going to take one more. You're going to see a light flash. Okay, and that temperature is a bit warmer than usual. Are you feeling a little bit cold? I can always get you another pillow or a blanket. Okay, let me write that down. Temperature a bit more warm. Did you come in feeling a bit sick today? That's okay, if you can let me know. Okay, and next what I'm going to ask you to do is just sit still. I'm just going to check around your scalp to see if you have any abrasions or scratches, etc. Is that okay with you? Good. I'm just going to carefully just check around the scalp. Do you know if recently you have been having just a bit more tiredness than usual? Okay. Just tell me anything you want to let me know, okay? Just giving you a quick braid to move that out of the way. Okay, looks like your scalp is clear. I'm gonna get some gloves on now. And we're gonna start off with just touching around your face. Okay. Is that medical bed cozy? Good. If you need me to adjust it at all, let me know, okay? Now, do you have any allergies? There are many allergies. You can have allergies to peanuts, which is very common. Do you have any allergies to coconut? Do you have any allergies whatsoever, even gluten? Okay, I'll make sure to write that down in your journal. And I'm just going to touch just roughly around your face, okay, and around your eyes. Just sit still. Okay, could you look at my nose? Okay, can you look at that little picture on the wall? And can you look at this Snellen's chart right here? Have you had any problems with your vision lately? Okay, do you wear glasses or contacts typically? Okay, and then a quick question. May I shine a light in your eye? If it's too bright, let me know and I'll move it away. I'm going to be checking to see if your pupils are dilating and contracting properly, okay? I'm just going to put one hand here. If I could ask you, could you please look at my nose? I'm going to get really up close here. Just look at my nose. Good. Great. Pupils are working as they should. They are dilating and contracting well. Good. Okay. Look at the light for me right there. Okay, and moving the light away. Can you look at the light again? Good, and moving the light away. And once more, can you look at the light again? Good, and moving the light away. Now I'm going to ask you, do you feel any sense of dizziness since I put the light next to your eyes? Okay, let me know if that changes at all. I'm going to do the other eyes now, okay, darling? Okay, can you look just right at my nose while I do this? Good, just look at my nose. I'm checking to see if your pupils are working well. Good. Just checking to see if the pupils are working well. Looks like they are. Okay, same as before. Could you look at the light for me? Good, and moving the light away. Great. Look at the light for me. Good, moving the light away. And can you look at the light for me? And moving the light away. Good. And I'm going to ask you again. Are you feeling any type of dizziness since I put the light next to your eyes? Okay, let me know if that changes at all, okay? So, I'm going to actually use another tool now to take a look at the side of your eyes, look at your cornea. And what I'm going to ask you to do is follow the light to the best of your ability. And I'm going to even give you a red light analysis to see if your corneas are looking good. Okay, so I'm going to get up real close, okay? And there's going to be a little light that's right there at the end of this tool. I'm looking carefully in your eyes, okay? So just follow that light. Good, follow the light. Good, follow the light. Good, look at the light. Great, follow it. Unfollow. Good. Follow the light. Good, follow it. In this direction. Good, and look back at the center. I'm shuffling to see that there is everything going right with your eyes. Good. Okay, a little closer now. Just look at the light. Good, and follow it. Good. And follow it the other direction. Good. Great. Okay. Good job. It looks like your eyes are doing well. You happen to have very beautiful brown eyes. They're slightly blue as well. And you even have a touch of green. Gorgeous. I'm now going to touch around your face, okay? And you let me know if you feel any pain whatsoever, okay? And I know that you're sick, so let me know if that changes at all. Any pain, yes or no? Okay, yes or no? Yes or no? Yes or no? What about here? Here. Yes or no? Yes or no? Yes or no? Yes or no? Very good. Very good. Okay. Now, I'm just going to take a look at your vitals carefully. We're first going to get your heart rate, okay? And I'm going to use the stethoscope. And I'm going to place it here on the chest and here. And then we're going to listen to your lungs and your stomach, okay? Good. All I want you to do is listen to what I say, okay? And just keep relaxing on the medical bed. Let's place that right here. Okay, there. Okay. And what I want you to do is just breathe in and breathe out. Good. And let's listen carefully. Good. Other side. Right there. Okay. And breathe in and breathe out. I'm going to place it on the abdomen now. We're just going to listen for bowel sounds. I know that sounds silly, just to make sure that everything's going well with you, okay? So, let's put that right here. Great, that sounds perfect. Now, I'm going to listen to your lungs. Is that okay if I just reach around and place this at the lower part of your shoulders? Okay. I'm going to just reach right over here. And what I want you to do is just breathe in and breathe out for me, okay? So first, breathe in. And breathe out. Good. Through here. Breathe in. Breathe out. Perfect. Over here. Breathe in. And breathe out. And once more. Breathe in. And breathe out. Good. Okay. So, I am listening to everything carefully. So far, it looks like your vitals are doing okay. You just sound a little bit sick. That's okay though. Okay. I'm gonna continue now checking your sinuses and your nose and your mouth, okay? So, if I could ask you to just carefully, can you look at the light? I'm just gonna check your nose. Good in there. And is your nose a little bit clogged currently? That's okay. Good. What I'm gonna ask you to do now is, can you just say ah for me? Say ah. Very good. Are your teeth bothering you at all? Okay, any problems with a sore throat? Okay, just looking one more time. Say ah. Good, that looks perfect. Okay, and relax with that. I'm gonna check inside your ears now with this little tool. You're just gonna hear me rummaging around. I'm just gonna look if there's any ear infection or any sign of that, okay? Good. So, I'm just gonna shine this right through there and take a look with my eye, okay? Okay, it looks like just a little irritation for the ear. No sign of infection though, which is great news. Okay. do you happen to wear any hearing aids or any tool that helps you listen to things? And do you wear headphones? Okay. Now, do you limit the amount of loudness or volume you hear if you listen to music or the radio? Okay. We highly suggest that you lower the volume, and we also suggest that you try not to sleep with headphones in your ears because that could cause ear infection, okay? Good. And we're going to move on to the other ear now. Please pardon the airplane. Okay, I'm going to take a look right there. Just looking right inside the ear, okay? Okay, this ear is a little bit more irritated. But it looks fine. And can you hear the tool in your ear? Good. Okay, so your ears are doing super well, and it looks like that's perfect news. Okay. Let's continue now. I'm gonna just carefully test your ears and put my hands around it. Can you hear this? Good. Can you feel this? Okay. I'm gonna cup your ears now. Will you let me know if you can feel that? Good. Just going to put my hands right there. And does that sound a little bit different? Good. Okay, that is exactly what we're going for. Good. So, looks like your ears are working well. Okay. Next, I'm just going to put my hands here and move to the shoulders. Let me know if you can feel this okay. Okay. And now your lymph nodes, can you feel that? Does it hurt at all when I put some pressure next to the lymph nodes? No? Good. And then can you just swallow for me like usual? Good. Now just around the side of the neck. Okay. And the shoulders. Fabulous. Now, I'm going to carefully just test your musculature, okay? I'm going to tap on certain parts of your face and you're going to react naturally. Don't worry about reacting, we're just going to tell right from this. Okay, good. So let's see right here. Good, under the eye. Here. Chin. Good reaction. Okay. Shoulders, yeah. Chest. Shoulder. Can you give me an arm? Good. Elbow. Hand. Good. And can you wiggle your fingers for me? Good. Other arm, please. Shoulder. Elbow. Hand. And can you wiggle your fingers for me? Good. Okay. Now that you're laying down, can you just bend the knee a little bit? And if you can, try not to kick me. I'm going to test your reflexes on your knees, okay? Good. Bend the knee. Once more. Good reaction. Bend the other knee. Good. Perfect. Okay. then we're going to test your ankles, okay? Good. Super. That's perfect. Okay. And do you have any pain for me testing there at all? Okay, just let me know at any point if you do, okay? Okay. And I'm just going to quickly test your cranial nerves because you are sick. I'm going to pull out 3 essential oils here. And all you have to do is tell me what you think they are, or close to it. They don't have to be accurate, okay? But I pulled out 3. Close your eyes and tell me what you think they could be, okay? They are very basic and common essential oils and smells. They're not too difficult, okay? Okay. So, close your eyes and don't take a peek. Let's see if your cranial nerves are working well, okay? So, keeping your eyes closed, what does this essential oil smell like? Okay, you're smelling floral, tea, herbal. Any guess? Okay, good. That is floral. Good. This one's actually lavender. Great. And the next one. Keep your eyes closed, okay. And what is this next one? Right under your nose. Don't take a peek. That one smells like citrus, like oranges. You got that one immediately. Very good. This one was orange. On to the last one now. Okay, keep your eyes closed, okay. And what's this last one? Breathe in and breathe out. Okay. And what is that one? That one's refreshing, opens the sinuses, and it's minty. Very good. You got it. That last one was actually peppermint. And all those answers were acceptable. Good job. Great. Now, I'm just going to carefully take a look right at your eyes. Looks like your eyes are fine. Looking right at the nose. Okay, the mouth. Good. Ears. Shoulders. Arms. And legs. Okay, good. It looks like your head to toe exam is complete. I am going to be sending your results in to the doctor, and they'll perform a full exam afterwards. And there are going to be the ones that will prescribe you medicine to help you feel better, okay? Good. Again, I have been Nurse Cece. I am checking you off on our good list for this nurse head to toe exam, okay? And the doctor will be in shortly. If you need me whatsoever, all you have to do is hit the button that's at the side of the bed. And we can also go over your exam results by morning time. Is that okay with you? Great. So, the doctor will be in shortly. I'm just going to close out here, and I want you to relax before the doctor sees you, okay? Great. Thank you so much for coming on by to Dream City Clinic. And I will see you after the doctor sees you again to talk about your results, okay? Good. Have a good one now. Bye-bye. Okay. Okay. Patient's vitals seem to be good. Let's see here. I'm just going to adjust that. Okay. And hi there. Welcome to Dream City Medical Clinic. I am Nurse Cece. Yes. I hear that you've just been extra tired recently, maybe feeling a bit just fatigued under the weather. Yes. Well, I will be performing a basic head-to-toe exam for you in the medical bed here. Is it comfortable enough? Okay, I'm just going to first tuck you in before we start the exams. Is that okay with you? Good. You have a gorgeous name, by the way. And how old are you? And your birthday? Okay. And when did you start feeling very tired? Was it today? Okay. And would you say that you've just been feeling a bit tired, maybe a cloud, for the past week? Okay. I'm just writing these notes down there between me and you, I promise. Pinky promise, okay? Good. And I'm just gonna get ready to start this in-bed exam now, okay? Good. I'm gonna pull a chair up really quick for me. Okay. And we're gonna start off by getting your vitals, okay? I just sanitized my hands before I walked in. Good. Let me get some gloves on. Do you prefer pink or blue? Okay, we'll do blue for now. How was your day? Okay. And remember, your health is not just physical health. It's also how you're feeling mentally. Are you okay? You can tell me anything, okay? Good. So, I always do this first. Do you think you can give me your hand? I'm gonna put this on your finger, okay? Good. So, just relax. I'm just gonna get that right there. And I'm just gonna attach that to your finger. And then we count down 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good. Looks like your oxygen level is at 98%, and your heart rate, beats per minute, is at around 78. That's very good. Have you been feeling any cold or flu-like symptoms within the past 2 weeks? Any changes with appetite? Okay, any sense of cold or fever? Okay, and any extra stress? That'll do it. I'm listening. Okay, now I'm gonna take your heart rate. Is that okay with you? It's a bit cold. Okay. So, I just want you to relax. I'm gonna place this on your chest and next kind of to your shoulder here and here. Is that okay with you? Good. I'll try not to make it too cold. Let's place that right there. Okay, and just breathe in and breathe out. Good. Good. Other side now. Again, a little bit cold. I'm sorry for that. Now just breathe in and breathe out. Focus on that, okay? Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. And breathe out. Good. I'm going to place this next to your abdomen now. It might sound like gurgles. It's just your stomach, okay? So just a little bit lower. Good. Lower. Good. Good. And now I'm going to listen to your lungs from your back, okay? So I'm just going to place it on the back again, left and right next to your shoulders, okay? Good. Just relax. And I just want you to breathe in and breathe out. Good. Breathe in and breathe out. Good. Other side. Okay. Breathe in. Good. Breathe out. Good job. Breathe in. Good. And breathe out. of sweating a bit. Any sense of that recently? Okay. And do you feel like you have had decent breathing? Do you have asthma at all? Any allergies, by the way? Okay, and do you feel like you've had a normal time with the weather change recently as well? Okay, thank you so much. Now what I'm gonna do is I'm gonna get your temperature. Okay, good. Are you still cozy? Do you want an extra blanket or pillow at all? Okay, let me know if you do. So I'm just gonna get a little thermometer here. It's a bit loud, I'm sorry, but you'll hear a beep, okay? Good. A lot of people find this part to be very soothing. In fact, most people tend to fall asleep. So I'm just gonna place this right on your forehead. A little bit cold again, but you're gonna hear a beep, okay? I'm gonna do it twice. Okay, and it's on your forehead, okay? And you'll hear the beep. Good. And your temperature is at perfect. And then once more. Let's begin. 3, 2, and 1. Perfect. Temperature. Do you feel any sort of body soreness at all? Okay, let me know if that changes or if you do, okay? Good. So your temperature is average. It is currently at 97.6 degrees Fahrenheit, and it would be a bit more accurate if we gave you the different thermometer that you put right under your armpit, but we're just going to do the forehead for now. Okay, I'm going to test your eyes now. Is that okay with you? Do you have any light sensitivity at all? Okay, let me know if it gets to be too bright, but we're going to do 2 parts of this eye exam. The first part is with the lights on. I have 2 medical lights here. The second part will be with the lights off or dim. Is that okay with you? Good. Let me know at any moment if any of these exams happen to be too bright, too much, etc. I'm going to stand up a little bit for this as well. Okay, so I'm going to get up a little bit and I'm going to ask you, do you think that you can see this light right there? Good. Now, do you see this light right there? Good. And what about there? Good. And a bit up close, I'm going to look at your eyes now. What about there? Good. Now, a bit up close here, okay? Let me know when you see the light. Just touch the outside of your eyes, but just look at my nose. Using your peripheral vision, let me know when you see the light, okay? Good. 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 Great. Good. 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 Great. Okay, I'm gonna back up now a little bit. Now, let me know when you see the light disappear from your vision, okay? So, take a look at the light right there. Okay, and then let me know when you don't see it anymore. Good. Once more, take a look at the light and let me know when you don't see it anymore. Good. Look at the light. Let me know when you don't see it anymore. Good. Okay. Look at the light. Let me know when you don't see it anymore. Good. Look at the light. Let me know when you don't see it anymore. And then once more, look at the light. Let me know when you don't see it anymore. Good. take a seat now. And then what we're gonna do is I'm gonna turn the lights off here. And we're gonna try this without any light. So, let's see how you do. I think you'll do great. Let me know when you see the light. That's it. I'll ask you when. Do you see the light? Good. And do you see the light? Good. And what about now? Good. And do you see the light? Yes, it's shining on my face. Good. What about now? Good. And now? Good. And what about now? Good. And what about now? Good. Okay. And quick test. I always bring out 2 different lights when the lights are off. Do you have any color deficiencies with your eyes? I have 2 lights here. One of them is a yellow or a green, and the other one is a pink. Let me know. Can you see both of them? Can you see the pink light? Good. Can you see the yellow light? Good. And pink light. Good. And yellow light. Good. And which light appears to be brighter, the pink light or the yellow light right now? Good, the yellow light. And which light appears to be brighter now, the pink light or the yellow light? Good, the pink light. Very good. I'll turn the lights back on now. And we're going to give you the physical head to toe portion of the exam. Okay. Are you doing well? Good. So, what I have right here is a muscle reflex machine. And I'm going to tap, 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 tap that from head to toe to see if you have good reflexes, okay? Good. Any recent change with maybe a numbness on a certain side of your body? Musculature changes where one side is performing significantly better than the other? Okay. And are you left-handed or right-handed? Good. You can also be ambidextrous. Okay. So, I'm just going to tap, 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 tap. And you don't need to say anything. I'm just going to see your reflexes. However, if anything bothers you, will you let me know? Good. So, just relax. I'm just going to tap right there. First on the forehead. Good. Good. Nose. Center of forehead. Good. Around the eyes now. Good. Good. Now below on the cheek. Good. Good. Below. Good. Good. Above the cupid's bow. Good reflex and on the chin. Good. Good. Okay. Shoulders. Good. 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 Okay. I'm gonna feel your scalp. Okay, let me know if it bothers you at all. Okay, a little bit. Okay, any bothering? No. Okay, I'm gonna feel your lymph nodes right underneath your chin. Is that okay with you? Good. And then I'm gonna ask you, any pressure, does that hurt at all? Okay, and then a bit like that. Okay, so I'm gonna take a look inside this ear, okay? Any differences between hearing with left and right ear? Okay. Okay. I'm just gonna take a secondary look right there. Okay. And on this side, I'm just gonna ask you to relax there. Good. Okay, good. Let's continue with the musculature test. Okay. So we're moving on to your shoulders. I'm gonna first ask you if you can lift your shoulders for me. So I'm gonna put my hands right on your shoulders. Can you lift them? Good. And then I'm gonna put pressure down on your shoulders. Can you resist that? Good. Good. Now let's test your arm. Let me have this arm first. Good. Good reflex. Good. Good. And all the way down to your hand. Good. Good reflex. Other side. Let's see here. Right there. Good. All the way down to your elbow. Good reflex. Good. And good. Good. And then right onto the part of the armpit. Let's see there. Good. Other side. Good. Okay. Now give me your hands. It sounds a little silly, but I want you to shake my hand. However, what I want you to do is it won't hurt me, trust me. I just want you to grasp my hand and squeeze as much as you can, okay? It will not hurt me. But let's try. Here's the first hand, okay? And squeeze my hand. Very firm handshake. Good. Other side. Squeeze my hand. Good handshake. Good. Perfect. We're going to move on to the abdomen now. A bit of pressure right at the center. Tell me if you feel any pain with that, okay? Good. And there. Good. We're going to move on to the legs now, okay? I'm going to just move myself back a bit. Let's see your legs. Good. Bend the knee. Good. And then good reflex. Good. And then we're going to move to the other leg. Please bend the knee. Good. Good. Once more. Good. Good reflex. Now your ankles. Good. This side. Good. Good. Okay. So your musculature is working well. Perfect with that. Let's move that over there. And it also appears that most of your muscular function is even. Now, do you feel any side that had a bit of a difference with sensation, perhaps? Your left side felt more, or your right side felt more? Okay. Okay. And quick question. When was the last time you had a full 8 hours of rest? Okay, we're gonna have to improve those numbers because the more that you rest, the better you will feel. And I know that it's very stressful, but I want you to know that we're here for you, okay? We do also write notes if you are during school or work performances that require you to leave. I will write you a very good note saying that you require more sleep and or you need a day off, so please don't hesitate to reach out and let me know. I'll write whatever you want me to write. Okay. And then now what I'm going to do is I'm just going to feel around the peripherals of the face and the shoulders, okay? And this last good part of the exam I find is the most important. We're just going to be doing a little quick cranial nerve function exam to see if any of the lack of sleep has caused you executive function problems such as movement, eye function, nystagmus, etc. Okay, good. So, on your face, okay? I'm going to put a bit of pressure on your eyes, okay? Just a bit. Keep your eyes closed. Good, relax. On the chin. Now on the forehead for the sinuses. Good. Any sense of pain there? I'm going to shine a light onto the sinuses right there and there. Just sit still for that. Good. Other side. Good. On the top. Good. And on the other side. Perfect. Sinuses appear to be working well. Okay, let's write that down. Okay. Now, just some simple focusing things. Can you look at my glove and look at my finger? Just follow my finger. Fabulous. Good. And then look up. Good. Look down. Look over here. Good. Look over here. Good. Look down there. Good. And look down there. Good. Now let me know which hand is closer to you. Left or right? Good. Left or right? Good. Left or right? Good. Left or right? Good. Now, let me know. I'm going to carefully put pressure on your face, just a little bit. And I'm going to ask you if it is soft or sharp. I'm going to do this to your face, your arms, and then your legs. Close your eyes for this because you will easily be able to tell. But I have a little tool here. One side is very soft, and the other side is slightly sharp. It kind of actually feels like a toothbrush. A little scratchy. You let me know if I'm doing soft or sharp on your face. Okay, let's begin. Close your eyes for this. First on your face, close your eyes. Soft or sharp? Soft, good. Soft or sharp? Good. Soft. Soft or sharp? Sharp. Good. Hand on the forehead, soft or sharp? Sharp. Good. Give me one arm, please. Okay. Soft or sharp? Good. Soft. Soft or sharp? Sharp. Good. Other arm, soft or sharp? Sharp. Soft or sharp? Soft. Good. Now one leg. Good. Soft or sharp? Good. Soft or sharp? Sharp. Other leg, soft or sharp? Very good. Sharp. Okay. You did absolutely fantastic. I will share your results as soon as we're done with the completion of this test in the morning. I'll let you rest for now at the clinic. Let me get some of my items before I leave. But thank you so much for allowing me to perform the nurse medical exam in the bed. I appreciate that. And let me get some of my items here. Okay, and now for you. I will be checking in with you in the morning at about 8-ish, 8.5 hours from now. The next nurse that will come in about 5 minutes and apply sleep stickers to analyze your sleep on you, okay? But relax and rest for now, you need it. I know you're feeling very tired and maybe you just need a little bit of relaxation, so I will be on my way. It was such a pleasure to meet you again. I am Nurse Cece. You can call for me anytime you want. You do have a nurse call button right to this side of the bed. It's just the big red button. Hit the button and someone will come in immediately and you let them know what you need. Okay. Thank you so much for allowing me to be your nurse today. We will share the results in the morning, okay? You rest well. Thank you so much for coming on by and cheers now. Peace. Okay. for your medical exam, correct? Good. No need to sit up, just keep sitting right back in that medical chair right there. And I'll be the one sitting in the chair in front of you, okay? Hi. Hands all sanitized. You're here for a in-bed exam. Please don't sit up, okay? You can keep relaxing. And I'm just gonna perform a head-to-toe nurse exam for you today, okay? Good. I'm Nurse CC. Are you okay with me being in charge of your care today? If not, we've got about 7 other nurses, and I'm sure one of them you'll like. You're okay with me? Okay. If at any point that changes, let me know. Everything is fair in my game. Okay. I'm gonna quickly check you on in. It looks like you've been having trouble sleeping well throughout the night, and the doctor prescribed you to stay here overnight so we can watch you, correct? Good. So, quick question, name and last name. Do you spell that with an I, E, or Y? Good. Birthday with the year. Are you a Scorpio? Fabulous. I'm sometimes right with that and sometimes wrong. Okay. And before we begin the exam, do you have any allergies I should know of? Because I want to make sure your care is top tier. Okay, so none of that. Okay, before I examine you, let me quickly tell you what we're going to do. We're going to give you a head-to-toe exam. Have you ever had that before? I'll quickly show you. So, this procedure is very simple. A lot of people find it relaxing, as I still want you to lay in the bed during this exam. No need to get up. Okay. We're just going to be checking all aspects of your body and medical performance. Head to toe. That includes your eyes, your nose, the function of your muscles, your ears, your hands, your arms, your legs, your lungs, etc. Is that okay with you? Just basic care. Okay. Let me get some gloves on and let's begin. Thank you. So, it looks like you may have also bumped your head trying to get to sleep. I noticed it right there in the top corner. Okay. I'm going to be a little bit more quiet during this exam again because it is so late. So, pardon me for being a bit quiet. A lot of people find the nighttime exams to be very relaxing, so just lay in bed. If you need a blanket or anything, let me know. I'm going to begin by looking into your eyes, and I'm going to ask you a couple of questions, okay? Okay. Are you able to look at that light for me? Good. Try not to get distracted by my hands. We're just going to grab your vitals, and I'm checking to see first that your pupils are dilating correctly, okay? Does that light bother you at all? Is it too bright? Just keep looking at it until I say stop, okay? And then we're going to move on to getting your heartbeat. Okay, thank you. Can you quickly say ah for me? I'm going to just ask you to do a set of things, okay? Okay, have your teeth been bothering you at all? Okay, get your heartbeat. This may be a bit cold, I apologize. So, I'm going to place it on each side of the chest, and I'll let you know when to breathe in and breathe out, okay? Breathe in. Breathe out. Good. Breathe in. Breathe out. Okay. Move that to the center now, right there. Breathe in. Breathe out. been having any stomach pains, such as stomach aches or trouble falling asleep due to acid reflux? Okay. I'm just gonna listen to the stomach now, okay? That sounds great. I'm going to reach just around the side of your shoulder to listen to your back. And I'm going to listen to your lungs. Do you have any lung issues I should know of, like asthma, or maybe do you take an inhaler for whatever reason? Okay. Let's see, reach right all the way, and let's listen carefully, okay? Breathe in. Breathe out. Good. Breathe in. Good. Breathe out. Good. Breathe in. Okay, and breathe out. Good. So, I'm going to put this little button on your finger, and it's going to measure your oxygen level. And then I'm just going to quickly get your blood pressure, okay? Can you give me one of your hands? It doesn't matter which. Let's see. Oh my goodness, you have beautiful fingernails. Let's just clip that on and we'll hold it for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Let's see. Pulse oxygen level at a 98% for oxygen SpO2, and your BPM stands at around 84 beats per minute, which is perfectly fine. So, I'm going to place this around your arm, and I'm going to listen carefully. Just give me one of your arms. Good. Let's place this around. Right there onto this arm. Okay. And just relax. And let's listen carefully. Good. Let me know if you feel any pain from this, okay? Good. You're doing great. Good job. So it looks like the back of the corneas look good. Your eyes do look a little bit irritated and red, probably due to lack of sleep. Do you wear glasses or contacts at all? Keep look at the light now. Okay, are you someone who stares at a phone all day? Okay, that could be causing a little bit of blue light infraction in your eyes, which would cause your eyes to be tired and also stop you from sleeping well, but you're doing great. Can you follow that light for me? Just follow it. Follow that light. Good. Follow the light. Good. Great. Okay. Now, I'm going to just carefully look into each eye one more time, but I want you to look at where my little hand is, because I'm going to be staring deep into your eyes, okay? Can you look at my hand right there? Good. Follow it there. Follow my hand there. And follow my hand. Look here. And look there. Good job. Okay, on the other side now, let's take a look into your eye. Look at my hand though. Follow my hand here. And there. And here. Follow my hand there. And here. And there. Okay. Good job. What I'm looking for is a type of corneal abrasion. It can actually happen super easily if you scratch your eyes like that. That can easily be how you get it. Happens all the time. I take care of people on the daily. So, have you had any irritations with your eyes lately, or do you feel like lights have been too bright, such as screen lights like a computer, a cell phone, a tablet, television? Okay. And have you been using electronics before bedtime? I highly recommend, if you do use electronics before bedtime, make sure the content is relaxing or lowly lit, such as turning the brightness off on your phone or tablet or television, okay? Good, thank you for listening. So, I'm going to give you a color test here. Are you someone who's color partial or unable to see colors? I always do this because sometimes if you're absolutely tired, you can get the colors incorrect. What I want you to do is just try your best, and even if you're unable to see colors, take a guess what the color is, okay? Okay, let's start. I have my panel here. And what does this one do to your vision? Can you let me know? Everything is green, kind of blue. Okay. And do I look green or blue? I do. Okay, good. Good job. What about this panel here? What does this one do to your eyes? Everything is pink. Very good. And can you tell me what color is my nurse outfit here? It's blue. What about my gloves? Blue or purple? Okay, good. You're doing great. What about this panel? What does this panel do? Everything is blue. Okay, quick question. I do have a candle back there. What color is the candle? Kind of like a yellow or a green. Good job. Okay, 2 panels left. You're almost done here, don't worry. What color does this panel make everything? Purple. Okay, and what color is my scrub? Blue. What about my glove? Blue. Good job. And last one here, which I'm going to pull a test on with. What color is this panel? This one is the most obvious. This one is red. Very good. A quick question here. What color are my scrubs? They're like a dark purple or blue. And what about my glove? Same. I'm going to give you a red light panel test. And what I want you to do is let me know what color is the light. Is it white in the center and red on the rays? It is. Okay, and what if I move the light all the way back? Is the light white at the center but red on the rays of light that shine from it? Good. And what about this direction? The same. Here. The same. And what about down there? The same. Okay, looks like your red light infraction test is doing splendid. Good job. So, it looks like your eyes have not been affected by the lack of sleepiness, which is perfectly okay in my book. I'm okay with that. I like to hear good news. Okay, and you say yes or no. Are you ready? Let's start all the way at the scalp. Here. Okay, and here. Here. On the eyebrow. Here. 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 Okay, and let's start right at the side of the neck. Here. Triceps here. Here. Good. And what about there? Here. 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 Okay, give me your arms. I'm going to test the reflex muscle right at the center of the arm and right at the wrist. Good musculature. Could you feel that? And then the hand. Good musculature. Other arm. Here. Good musculature. Could you feel that? Good. Let's test the knees. Just keep laying down. I'm going to just see if your knee muscle works. Good. Good. And now the ankle. Good. Good. Okay, moving all the way forward now. I'm going to test right behind the ears. Can you hear this over here? Good. And what about over there? Good. Musculature seems to work. Okay, you're doing great. Now what I'm going to ask you to do is just a quick hearing test, nothing too strenuous or wild. I have these tools here. They are known as tuning forks. I only have 2 or 3 of them with me right now. And I want you to let me know if you can hear them. As simple as that. Okay. So, your ears are here. Can you hear this? Good. Can you hear this? Good. And can you hear this? Good. Let's test with the tuning fork now. So, I'm going to start off with, this one is a C sharp. Let me know if you can hear it, or when you can. Could you hear that? I'll do it again. Could you hear that? Great. Okay. The next one we have here is, I think this one is a B. That one sounds great. Can you hear this? I'll try again, okay? Could you hear that? Good. And last one here. This one is the largest of the tuning forks, but this one is the hardest to hear. It's okay if you say you can't hear it, because I can't either. Yeah, can't hear that at all. Let's try. Can you hear that at all? Not really. Let's try it again. Let me know if you can hear this. And what do you think? Not so much. That is A-okay. Okay. I'm going to give you a very quick smell test and a taste test, and I'll let you be on your way, okay? I have 2 essential oils here, and I need you to identify the difference between the 2. Okay. So, perfect. 2 here, and they're very interesting. You won't be able to see the label, so you can keep your eyes open if you like. But let me know what you think this essential oil is. But put that right under your nose and just explain what you think you smell, okay? one more here. This one is a bit more interesting. Okay. I love the smell of this one. It's under your nose now. Please breathe in and breathe out. What is this one? It smells like flowers. It smells like a spa. It smells floral and earthy. I think you've got this. Any guesses to what exactly it is? Because flowers was correct. This one is lavender. Great job. And we're going to give you one final test here. I have two taste tests here. One of them is strawberry and one of them is blueberry. I'm going to shuffle them below. And I want you to identify which one you think it is, strawberry or blueberry, okay? So I've chosen one at random. Say ah. We're going to drop 3 drops. And what do you think this one is? Just taste. Good. Did you get blueberry? Because it was blueberry. Good job. Okay. So we're going to rerun the analysis on you now, and we'll recheck you again in the morning for your lack of sleep. But what we were doing is we were studying your ability of your cranial nerve and basic health functions with the head-to-toe exam to see what could be impacting your sleep, okay? Okay. I will let you rest now, but I will recheck you in the morning as I will be working all night long, okay? If you need anything, hit the button next to you on the right, and we can get you pillows, blankets, and we do have snacks, okay? Just let me know, and we're going to reassess you in the morning to see how we can fix your sleep, okay? The doctor will be in the morning as well. Okay. Have a great night. Thank you for being so patient with me. Again, I'm Nurse Cece, and I will be re-seeing you in the morning. If you'd like to give me a good rating on your My Chart, I would greatly appreciate that too, okay? If there's anything I should correct for next time, write it down on there too, okay? Thank you. Have a good night now, and just keep resting in the bed. I'll turn the lights off very carefully so that you can also go to sleep, okay? Ciao now. Bye. Have a good night. And looks like you have finally awoken. Yes, you are here in Dream City Clinic, and you are resting in one of the medical beds here in the Dream City Clinic Health Line. Yes, you are here because you are feeling a bit under the weather, so we asked you to stay just a bit overnight to check your health. Yes, and I'm here to perform a late at night medical exam to make sure your health is okay. Perfect. It's a pleasure to meet you. I'm Nurse Luna. Yes, I'm going to take a seat now, and I'm going to look at your documents. So, I was reading your medical files, and I was just checking to make sure everything was aligned. And if I look at your paperwork here, you did say you arrived and you were very tired, and you felt just a bit overwhelmed. Is that true? Yes. And you said that you were experiencing not the best sleep for the past couple of weeks. Is that so? Yes. And do you know if you've had anything like any type of sicknesses, such as a fever, perhaps a sore throat, headaches, etc.? Okay, I'll have to write that down. First, I'm going to just get some gloves on, okay? But your documents are right here. No worries. What we're going to do is something called a head-to-toe exam. And what that entails is a very relaxing medical procedure where we just check your health from top to bottom. That's it. Especially if you're staying overnight with us, we make sure that your health is our top priority. Yes. Again, I am Nurse Luna. I will be your nurse for the evening and as
throughout the morning. So, could you let me know when your sleep started to not be the best? Okay, I understand. And when did you start feeling a bit overwhelmed? When did that start? For a while, but then it just got a bit more. I understand. What I'm going to do first is I'm going to get your vitals. And we always start with checking your temperature. Is that okay with you? Okay. I'm going to put my hand right there on your face if that's okay with you. And I'm just going to check your temperature with this little tool we just put on the forehead, okay? Okay. Just relax, okay? Okay. And one more time. Good. Marvelous. It looks like your temperature is perfect. I'm going to quickly write that down into our book over here. I'm going to write down very good temperature. Marvelous. And what I'm going to do next is I'm going to take a quick look at your blood pressure. I have a tool here that we use to just put around your arm, if that's okay with you. Okay. So I'm going to ask you to relax, okay? And which arm do you prefer? Perfect. We'll use this arm. I'm just going to put this around your arm now. Let me know if it bothers you. Good. Okay. And I'm going to listen to one part of this with my stethoscope. And I'm going to just add a bit of air. Okay? Good. Just relax. Perfect. Now let me just get the reading of that off. And it does look like you were at around 180/75, which is perfect for the gauge. Good. Let me remove that from your arm now, okay? Good. Okay, marvelous. Now what I'm going to use is a stethoscope, and I'm going to be listening to your heart with something that we just put right there on the shoulder blades to get your accurate heart rate, okay? Good. So I'm going to just put this in my ear. Okay, I'm going to put this right there on the sides of your shoulders, okay? Just relax and breathe in. Good. Breathe in. Good. Perfect. And breathe out. Good. Perfect. Other side now. Breathe in. Good. And breathe out. Perfect. Now I'm going to test it right on your back, okay? Breathe in. Good. And breathe out. Marvelous. Good. You can relax now, okay? I'm going to put all these tools aside. Apologies if that was a bit cold. Now, what I do is we're going to start the head-to-toe exam. I'm first going to start by looking at your scalp. And I'm going to ask you just to relax right there in the medical bed, okay? Don't want to move you, especially if you're tired or you're feeling not the best. Yes. Would you like any other pillows or blankets in the meantime? You're good. Marvelous. Perfect. Now that I've put all those tools aside, I'm going to begin the head-to-toe exam now. We're first going to start with your me know if it does bother you. And I'm going to be covering one of each side of your eye with this little tool. All I want you to do is let me know if you're able to see the light. Does that sound good? Marvelous. I'm going to put this right over your eye, okay? And let me know, are you able to see a light? Perfect. And what side is the light on? Good. Other eye now. I'm going to put this over your eye, okay? And covering your eye. And let me know, are you able to see the light? Good. And what side is it on? Perfect. Good. And look back at me. Good. And can you follow this little cat right there? Follow that with your eyes. And blow. Marvelous. Now follow the cat light, but try not to move your head. I'm going to just hold your chin. Just use your eyes to follow it, okay? And following it up. Following it to the opposite side, to the right. Following it below. And to the opposite side. And back to the center. Perfect. Looks like your eyes are functioning well. That's good. I'm going to use the pen light again. I'm going to ask you just to relax, and I want you to look at the sand over here that's on my left. Good. I'm going to ask you to let me know how many fingers I'm holding up, okay? So I'm going to shine the light into your opposite eye, but let me know how many fingers I'm holding up, okay? So relax. Good. And how many fingers am I holding up? 5. Perfect. How many fingers am I holding up now? 3. Perfect. And now 1. Marvelous. Perfect. We're going to do the same onto the opposite eye, okay? Good. So, right there. And how many fingers am I holding up now with the opposite hand? 3. Perfect. And how many now? 1. Marvelous. And how many now? 5. Perfect. Good. I'm going to get a bit close to you now. I do apologize. But I'm just going to check how your pupils dilate as I put the light closer to you, okay? I want you just to sit back and relax. And if you could stare right there at the Snellen's chart at the wall, that would be perfect. Just look at that and completely ignore the light, okay? I'm just going to get a bit close to you. I'm going to just carefully look at your eyes. Good. Perfect. Perfect. Looks like this eye has proper light dilation. The other one does too. Please continue to stare at the Snellen's chart. Thank you. Just going to look like that. And then to the other side. Just going to take a quick look. So the light looks to be working properly for that. Good. Looks like we're experiencing just the proper amount. Good. You can relax now. Your eyes are properly expanding with light. We actually have a little chart at the side of the pen. And your eye was perfect at around 8 to 9 millimeters, which is a perfect reaction if light is that close to your eyes. Yes, marvelous. Next, what I'm going to ask you to do is if you could just say ah. I'm just going to check your teeth. Okay, good. I'm going to ask you just to say ah very carefully, okay? Say ah, perfect. Okay. Looks like you do have all your teeth. Congratulations. And it does look like you do still have tonsils, don't you? Yes. Okay. And I do notice that you are taking proper care sensitivity or if they are swollen. So let me know if that bothers you. Okay, good. Put a little bit of pressure right there. Are you okay? Good. And I do see that they are just a little bit swollen. Do you feel that? Yeah, especially if you're not getting the best sleep. Your body overreacts in ways that makes it so that you will get your sleep. So, okay, and you can relax now. Good, just relax. You feeling okay? Good, so I'm going to quickly write that down in your notebook that you are experiencing just a bit of lymph node sensitivity, and that's normal. Good. Next, I'm going to check your ears, and this is always the fun part. So, we're going to be using an otoscope on you. I just got a new one, so you get to use the new one. And this tool allows me to see inside your ears. And what we are going to do is replace the lid. I'm going to get you a new lid. Okay. I'm going to turn the light on, you'll be able to see it. And I'm going to be taking a look inside your ears, okay? Okay. So, I'm going to start on one of these ears, okay? Good. I just want you to relax. Good. Just going to take a look. Do you hear that? Yeah, it just looks like a bit of sensitivity and some wax buildup, which is quite normal. Do you listen to loud music, or are you someone who wears like headphones or earpods before you go to bed? I do not recommend it. I would say just relax and try not to wear earphones so much. I'm going to take a look again, okay? Okay, now I'm going to look at the other side. Let's see if they are the same. Just relax, okay? Good, I'm going to be taking a quick look. And can you hear that? Good. So, it looks like both of your ears are working properly. It does seem that they are a bit irritated, so again I'm going to let you know, don't wear headphones so long and don't fall asleep with headphones on. And we're going to be checking your nose now. It might make you sneeze, just relax. Are you someone who has allergies or things like that? Yeah? Well, I'm going to take a look, okay? I'm going to look right into your sinuses. Okay, I see. Perfect. To the other one, just relax. Okay. Perfect. I did not see any sinus problems, so it looks like you're doing well. Good. What I am going to let you use is a bit of an allergy solution, because it did look like you were just a bit allergic there. I'm going to ask you just to breathe in and breathe out, okay? I'm going to apply a solution in 3, 2, 1. Breathe in. Good. Other side. 3, 2, 1. Good. Perfect. I'm going to let that rest, and we're going to redo that for the nose. 3, 2, 1. Good. And 3, 2, 1. saline solution to just help clean the nose. It's going to help you breathe and stuff. Yes, it's to just stop any type of stuffiness that you could get, especially in hospital, and it'll help you just breathe and relax. Okay. And next, what I'm going to be doing is I'm going to be looking at your scalp, and what we're going to be looking for is contact dermatitis and or lice. Yes, and perfect. So we're going to begin just looking for lice now, okay? Good. Just relax. A lot of people find this part the most relaxing one. It's going to be very fast. I'm going to carefully just brush through your hair like this. Okay. I'm going to be working a bit closer now. I apologize. Just going to... Okay. Getting my tool again. Okay, and on the other side. Okay. Okay. Checking the back of the scalp now. Okay, I'm going to get just a little bit of a comb, just going to right to there. Perfect. So, no sense of dermatitis, no sense of lice. It was perfect. Good. Looks like you're keeping your health up very good. Yes. And now we're going to move on to the musculature and movement of your body. So I always use this tool. First we're going to assess the face, then the shoulders, and then the rest of the ligaments that move, such as your hands, knees, and elbows. Perfect. I'm just going to carefully tap on your forehead to see if your body reacts, okay? Good. Just relax and sit still. I'm going to see if you make a reaction. Perfect. Onto the side of the nose. Good. Other side. Perfect. And on the chin. Marvelous. Could you look at me? Good. I'm going to put pressure on your eyebrows, okay? In 3, 2, 1. Pressure, pressure, pressure. Relax. Did that cause any sense of headache? Or are you okay? Good. Going to put pressure on the other side of the sinuses now, okay? Pressure in 3, 2, 1. Pressure, pressure, pressure. And relax. You okay? Good. And now pressure on the chin. 3, 2, 1. Applying pressure. Perfect. And relax. And any sense of pain or headache? Yeah, good. Good. I'm going to ask you to lift your eyebrows for me. Can you do that? Good. And relax them. And can you furrow your brows as if you were angry? Good. Perfect. Now, can you close one eye? Just close one eye. Good, and open it and close the other. Just close the eye and open it. Perfect. Now I'm going to ask you, can you give me a very cheesy smile? Good, and relax. And frown for me. Perfect. is a good assessment of your musculature with your face. Okay, going to move on to the shoulders now and the arms, okay? I'm just going to tap right down your shoulders to see if your arms move. You ready? Let's go, begin. Good movement, other side. Good movement. Now I'm going to test your arm. Please hand me your arm. Good. Hand. Good movement, relax. Good movement, relax in your hand. Good movement, perfect. Other side now. Test your movement right there. Good movement, perfect, relax. Good movement, relax, give me your hand. Perfect movement. I'm going to ask you just to shake my hand now, and it's not going to hurt me. I'm going to ask you to squeeze my hand as tight as possible, okay? Good. And 3, 2, 1, shake my hand. Perfect, and relax. And the other side now. Shake my hand. Perfect, and relax. So it looks like dexterity, muscularity, and reaction times are perfect, which is what we need to know for a common reaction test, especially for someone who's quite tired. Good. Now I'm going to test right at your knees, okay? And try not to lift your leg and hit me, okay? So just relax. 3, 2, 1. Perfect. Other side. 3, 2, 1. Perfect reaction. And now I'm going to try just at the ankle, okay? Good. And just relax. 3, 2, 1. Good. And the other side. 3, 2, 1. Perfect. And if it's possible, can you move your fingers for me like this? Good. Can I see your hand? Good. I'm going to flip the hand now. Perfect. Other hand. And flip the hand. Perfect. And are you able to move your feet and your toes? Okay. Please do. Perfect. It looks like all of the movement is working great. You can relax now. Good. So it does look like your generalized health is okay and functioning properly. We have one last test here, which is just a quick test of your memory. Could you let me know what day it is? Okay, and what time do you think it is? Okay, and just looking at some of your x-rays here. Just taking a look. It looks like all of your bones look good and you look quite healthy. Yes. Now, could you let me know what was the last meal you remember eating? Okay, and do you remember the last time that you drank a glass of water? Okay, so it has been a while. I'm going to write that down so that we can assess that for later. Okay, and just a couple of memory questions, okay? What is 2 plus 2? 4, perfect. What's 5 plus 5? 10, marvelous. What's 10 minus 5? Perfect. And what is 4 plus 3? 7, marvelous. Good, it looks like your brain is functioning well, which is perfect. Thank you. I'm writing that down. I'm going to be sending your analysis right to the sleep clinic where we are going to be seeing you next, okay? So it does look like you are experiencing just a bit of tiredness, especially with a little bit of delay. And that's okay, especially for someone who has been experiencing just a bit of feeling a bit unwell. Okay, I'm going to check up on you one more time in the morning, then we are going to send you to some appointments at the sleep clinic here at Dream City Clinic, and then we will see you in the sleep clinic, okay? I'm going to attach this sensor to your finger so we can monitor your sleep patterns, okay? Just hand me one hand, perfect, and the other side, good. And we are going to assess your sleep from now on and your health, okay? Perfect. I will check up on you soon one more time in the morning. Just relax and enjoy the rest of your sleep. Perfect. Again, I am Nurse Luna. If you need me, there's a button to the side. Perfect. Cheers and have a good rest of your sleep. Marvelous. Looking at the patient's vitals, okay. Check-in time. Late at night, in the evening, okay. Looks like, yeah, blood pressure is good and they are stabilizing. Heart rate. Perfect. as you were brought in is that you fell from your bed whilst watching the show and quite severely hit your head, and one of your eyes, this one, just looks a bit irritated and a bit damaged. Are you having any headache problems or visual problems? Okay. Okay, I see. Well, nothing to worry here. We're going to just give you a preliminary full body exam, a head-to-toe exam, and then the doctor will see you to see if you need some sort of stitches or if you perhaps have a concussion, and we'll go for treatment from there. Okay? So, could you let me know what your name is? And how do you spell that? Is that with an I or an E? Okay, lovely name. And do you perhaps remember your birthday? Okay, I'm going to double check that here with my other report. Good. And what is your address of residence? Okay, very good. Okay, now we're going to perform a physical exam. It's a full body part. I'm going to get my gloves on, okay? Now, how are you feeling overall? How are you feeling mentally, physically, emotionally? A lot of times, stress can cause you to injure yourself, and I want you to know that everything that we talk about here is confidential. Your health is our priority. So how has your physical and mental health been? Okay. Okay, you're safe, yeah? Okay, I'm listening. Okay, a bit stressful. Yeah. Stress is something that can cause you to change your emotions, your health, and most importantly, your well-being. So I want you to know it's safe to talk about that here. I'm going to first ask you if I may touch your face and your shoulders and your body to perform the full body exam first. Thank you. I'm going to first start with your scalp, if that's okay. I'm going to look for injuries and bruises, okay? Good. Don't move, I'm just going to work my way up into the scalp. Could you just tilt your neck a little down? Thank you. Just going to been sick in the past 2 weeks? Sometimes a fever can cause you to faint and fall from a bed or a chair. Okay, so we've got an oral thermometer here. This is not the other one. You're lucky today. And I'm going to take a tongue to press. I'm going to just put this right under your tongue, okay? I'm going to ask you to open your mouth, please. Thank you. I'm going to put that right under your tongue. Okay, I'm going to count now from 15. Okay, relax. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Okay, I'm going to release the tongue to press and take a look at the temperature. You are running a slight bit of a fever. Do you feel like you've been exposed to people who have been sick or have been out a bit more frequently? Okay, this could be because of stress then too. I'm going to write that down. So it's the fever, I do know that. You okay? Good. Now, I'm going to quickly get your heart rate. Though your vitals aren't currently hooked up to the machine there, we are running an IV with fluid through to you. It's always good to double check. Okay, so may I touch your chest? Thank you. Going to just carefully get this a little bit warm because this can be a bit chilly at times, okay? So, relax, breathe, and I'm just going to take your heart rate. Here we go. open your eyes now, and then close them, and then open them, and then close them, and then open them. Okay, I'm going to ask you to wink again. Start with this. Could you wink your eye? Good. The other, and the other, and the other. Okay, do notice there is some debris in this eye which I will have to get out. To open this eye particularly. Do apologise for getting so close, but the debris in this eye appears to be wavering your eyes, causing me to think that you may have a problem with your eye cranial nerves. That's important to your health, okay? Any visual problems? Okay. First, we're going to add a bit of a numbing cream into the eye, okay? And then I'm going to get that out of your eye. Okay, relax a little bit, okay? I'm going to ask you to look down to the ground for me, okay? Look down carefully, good. 1, 2, 3, 4, 5. I'm going to ask you to close your eyes now and open. Close, open, close, open. Good, I'm going to add it to the other eye as well to make sure they're even. So, lifting the eye up. 1, 2, 3, 4, and 5. Good. I'm going to ask you now, could you please close your eyes and open them? Close and open them. Close, open, close, and open. Marvelous, perfect. Now I'm going to get an eye cleanser and some sanitary solution to just cleanse the eye, okay? So this solution is green to help me mark, see if I've got an area in the eye. So I'm just going to get a bit of that, a little bit of green onto the cotton round. I'm going to ask you to relax, okay? Just going to be cleansing the eye. So keep your eye open. Look at me, okay? Look at me. Good, I'm going to ask you to quickly follow the light. Could you follow the light, please? Both eyes. Good. 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 Perfect. And above. Okay. The debris still appears to be in the eye. Keep looking at me. Look at my eye. Perfect. other eye. That's the one that has difficulty, is the one that we've been working on. Understandable. Relax. Can you close your eyes? So close your eyes as tight as possible. We're going to feel. Okay, and relax. Perfect. Now, I do see that you are smiling quite a bit, but can you frown? Like so. Good. Okay. I'm going to ask you with your hands, are you able to just wrap your arms around your shoulders like so? Okay, can you do that for me, please? Okay, wrap your arms around your shoulders like so. Marvelous. And can you touch your own shoulders to the proper side, left to left, right to right? Good. And now lift your hands up and do this, as so. Perfect. Now for the next cranial nerve exam, I'm going to test your visual priorities, especially with the eye that we just worked on. I'm going to ask you if you're able to touch your hand, my hand, to your nose in different directions. I'll do it with you, but I must see that your eyes are working properly, okay? So let's begin. Just touch with your hand and radio my palm. With your hand, touch my palm, and then touch your nose. Okay, and let's do it together. Good. 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 Perfect. Good. 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 Very good. Very good. What that proved is that there is no problem with distance, peripheral vision, closeness, and farness away. Perfect. Now, it's going to take a quick look at the rest of your body. For the full body exam, I do must assess that there are no cuts or scrapes on your arms, your legs, or your stomach. Yes. You do appear to have 2 arms, and could you lift your hands up like so? Lift your hands up like so and flip them around for me. Backwards, frontwards, backwards, and frontwards. Perfect. Do count 1, 2, 3, 4, 5. 1, 2, 3, 4, 5 for 5 digits on each hand. That makes 10 fingers. Perfect. Looking at your feet, are you able to roll your ankles around like so? Good. Can you roll them around? Thank you. And are you able to wiggle your toes? Good. Can you wiggle your toes? Perfect. Thank you. And if I'm going to count your toes, we do have 1, 2, 3, 4, 5 on one, and 1, 2, 3, 4, 5 on the other, accumulating to 10 toes. So it does appear that you have 2 legs, 2 arms, a total of 20 digits, and you're able to move around your arms and your legs. Marvelous. Perfect. So what I'm going to do now is I'm just going to apply a couple of things that we need to apply for the room, and then I'm going to set you up until the doctor comes to see you. What I'm going to apply is just a bit of a hydrogen peroxide. It is a very low solution, but this is going to help cleanse your wounds. It is a spray. I'm going to spray it onto a cotton round and apply it again to your eye and to the root on your head. This won't feel it at all. Okay, I'm going to carefully cover your face now too and apply a bit. Perfect. And now I'm just going to cleanse a little bit, okay? Carefully. this on the chin a little bit. Good, and it looks like a little on the eye. Perfect. Now I'm just going to quickly check your ears. Apply a little bit of cream. Very good. Any problems with your hearing? No? Let's check. May I touch your ear? Perfect. Good. Any pain? Okay, any uncomfortability? Okay. Going to feel a little bit. And can you hear this? Good. Can you hear this? Going to test a high sensitivity frequency. Can you hear this? Yes? Okay, and can you hear this? Okay, and let's test right. Can you hear that? Perfect. We're going to add just a little bit of a cream now to the lips. Go like this. Perfect. Just going to add a bit. Very dry. Can you go like this for me?